Welcome back to Quick Hits, the podcast where we dive into healthcare innovation with the people who are making change happen. I'm your host, Tyler Smith, CEO of Health Data Movers. Today, I'm joined by Olegas Niaksu, Head of Digital Health at AME International, a researcher at Vilnius University, and a digital transformation advisor to governments and development organizations around the world. Olegas has a fascinating story. He came into healthcare almost by accident while working on ERP and hospital information systems, but quickly got hooked by the complexity and potential of the digital health space. Since then, he's built a career around solving some of the toughest challenges in healthcare IT across Europe, Africa, Asia, and beyond. In this conversation, we talk about the future of remote and virtual care, the cautious but growing role of AI, and why some lower-income countries are leapfrogging legacy systems to adopt the most modern digital health tools. Olegas also shares a powerful perspective on the barriers that still exist, like limited local expertise, lack of financing, and misaligned priorities, and how international cooperation, especially in the EU, is pushing the boundaries of data interoperability. This is a wide-ranging, eye-opening conversation with someone who truly understands how digital health can transform systems at scale. Let's get into it. We're here with another episode of Quick Hits. And today we are joined by Olegas Niaksu, who is a leader in digital transformation in healthcare, and it currently serves as the head of digital health at AME International, as well as being a digital transformation advisor to governments and development organizations. Olegas, so glad to have you here.
Thank you so much, Tyler. Honored to be here as well.
Awesome. Well, you've had a fascinating career that spanned healthcare, academia, and advising governments on digital transformation. Can you walk us through your journey and explain how those experiences have shaped your perspective on digital health today?
Yeah, sure. First of all, thank you for this nice introduction. So, to begin with, I think it's important to note that I started working in digital transformation projects in various fields and domains before healthcare. So, basically, I came to healthcare with a radical understanding that we can automate, simplify, and improve things using IT. And
Mm-hmm.
then, naturally, as you can understand, I had a steep learning curve
Sure.
facing the multidimensional reality of healthcare. And this is, I think, a very interesting part. Also, it was very instrumental for me to participate and have firsthand experience witnessing how administrators, nurses, doctors work to understand challenges of operating healthcare facility. And then afterwards, I've learned another perspective of policymakers, departments might work with ministries of health in Asia and Europe or insurance funds. That brought completely another perspective. And finally, well, my academic experience, you will not believe, just 10 years ago, I was doing research in machine learning applications in medicine. It was
Nice.
just 10 years ago, and today it looks like a prehistoric stories. Yeah,
Yeah.
and that gave me enormous insight on the path from innovation to the moment when technology can be used. So basically, to sum it up, I think I became at the same time passionate believer in digitalization as a way forward to improve health systems, and at the same time down to earth expert who is not the first one to announce that AI will change doctors in foreseeable future. You know what I mean?
Sure. Yeah, no, great to hear a down to earth expert in a time where there's a lot of pontificating. And also, yes, totally understand your viewpoint that having a background in other industries, you're able to almost pull into healthcare innovations or even best practices, maybe not even necessarily innovations from other industries.
Hmm.
And you spoke about the steep learning curve, but What was it that actually pulled you into healthcare at the beginning?
Well, the story is actually by accident. It was not planned or designed. But after the first project, we were dealing with health hospital information systems basically back then,
Okay.
doing implementation in the quite huge tertiary university research hospital. And I've seen it's so multidimensional. The challenges are so interesting that I couldn't stop until today. Every half a year, I find a new chapter to open, and perhaps that's the reason. Basically, I'm attracted to this digital health domain.
Got it. And is that when you were working at Siemens?
Well, I've started with ERP systems,
Gotcha.
and then I changed my religion. Yes, I could say so.
Sure, sure. So, we obviously met in the United States, but the span of your research and knowledge is much greater. So, I'd love to hear some of the promising digital health trends you're currently seeing across Europe and globally, which we might benefit from in the United States.
Hmm. Well, we must admit that there are quite a lot of things going on, right?
Hmm.
And partly with an over optimistic hype, which is fueled by certain naivety or by VC backed finances. So, my typical role is to filter which ideas have high potential in foreseeable
Sure.
future for health systems, right? We have a number of interesting medtech concepts which are currently evolving. Well, if I would not be a big dreamer today and rather practical expert, I would say that virtual and remote care with all domains like remote monitoring of chronic diseases, virtual hospitals have a huge potential. And we
Okay.
see it in many countries slowly but steadily. We start really not exploring as a pilot, but start using that. Still early phase, but very promising. Uh, Yeah, second, I would say telemedicine and telemedicine not in a way like it used for the last 20 years, somewhere, somehow, but really becoming mature and in certain cases, primary channel of care. This is what I'm talking about, right? Not a telemedicine like 10 years ago, 20 years ago, we could call a doctor, right? It's also
Right.
telemedicine, but something which is really, really changing the way we deliver ambulatory outpatient care. So this is two. And third one, I know you most probably expect me to say something about AI, right?
Yes, very much so.
Which I'm really, really skeptical, not in a way that it's not meaningful or not promising, but I think it's not yet disrupting healthcare. I
Got
think
it.
we're overexcited with the potentials. However, we must admit it will change healthcare. Maybe not today, but it will change. So I don't know if you agree with my perspective, but I'm a little bit cautious here.
No, so just to repeat back, RPM, telemedicine, and AI are the promising digital trends that you're seeing across Europe and globally. Before I get to your point around AI, I'd actually just love to dig a little bit deeper in the three areas. So, if we were to get more specific, which markets or parts of the globe are you seeing the most progress in RPM, which we could benefit from in the United States?
Well, it's very interesting question because sometimes we live in understanding when we split the globe into low income and high income countries, right?
Sure.
But the reality is changing. So I've been recently in December in a great digital health conference in Kenya,
Okay.
right? And what I learned in last 5 years, many countries in Africa really advanced
Got it.
with a lot of startups and interesting applications and interesting implementations. In Ghana, so it's not only the richest like South Africa, right? In
Hmm.
many countries, and sometimes we live in our Western world bubble
Sure.
and not thinking really that China or Asia, or even Africa already not knocking the door, but bringing their own innovations.
Right.
So I would stop splitting the world in poor and expensive in terms of accessibility of technology,
Sure.
or capacity to understand, to utilize technology. Surely we have these levels of financial capacity, right? Or we cannot expect that low income countries would buy Epic or something similar.
Right.
But in terms of technology which can spread, some countries which are 100 million population, like Indonesia, for example, right?
Right.
Which have launched 2 years ago nationwide EHR,
Okay.
and is gaining the speed as we speak with the latest interoperability, right? So imagine in 2 years we have quite a lot of data,
Right. Right.
health data about every citizen. So what are enormous business opportunities in terms of application of machine learning, secondary use, or treatment advice, having all this base of aggregated data?
Sure. Well, you don't have to twist my arm to go to Indonesia as a surfer. I'm more than happy to go explore what innovations being made in Indo. And I guess my assumption would be its constraints and leapfrog effect. Constraints being somewhat similar to like what we saw with the shock around DeepSeek when resources are constrained, or whether financial
Mm,
or regulatory, it
mm.
forces innovation. And then leapfrog, if they're not having to deal with incumbent technology but can skip right ahead to the modern platform, there's an advantage in not having to spend time deconstructing the old models.
Absolutely. I think you nailed it 100%. First is limited resources, what I see in Africa today. They don't have time or money to buy something, so they run, to innovate and to apply and test and trial and fail and test. Yeah. So that's a recipe for innovation. And second, of course, we don't have legacy systems. We don't have all this huge legacy of systems and legislation as well, right?
Sure.
So, which especially in Europe, it's like running with a backpack full of stones. It's a little bit more difficult, right?
Yes, yes, but makes the runner stronger. Um, so, so on that point, and we kind of talked about these constraints a bit, but maybe just to expand on them. So when you're working with governments or healthcare systems on the digital transformation, what are the key barriers you encounter, and how do you help overcome
Oh, well, I will not be very original here.
them?
These barriers are usual suspects. So, first is lack of local competence in digital health, right?
Okay.
So you cannot really plan or implement if you don't really understand deeper the topic. Especially, you can make a lot of mistakes in digital transformation. You can see in United States, right?
Right.
Every state, every system reinvents their will, right? And every network of facilities buying, doing something. It's quite difficult. Then lack of financing. Of
Right.
course, we want everything digital and nice and shiny, but we don't have money for that, right?
Right. Right.
So more often than we would like to admit. And then, I don't know, maybe it will be unexpected to you, but very often governments have biased priorities. So, which comes not really after analysis what is really needed for population,
Got
but
it.
rather it's inspired by certain domain authority, a professor, a political party, right? Yeah, and final is overambitious goals. In many countries, in parliamentary or presidential countries, when you have a 4 years period before next election, you need to achieve something in 2 years.
Sure.
And this is not very helpful when you speak about project which needs 5 or 10 years, right?
Right. Right. Yeah. So essentially, human beings can get in the way with their agendas more often than we may like to acknowledge.
Oh yes, oh yes. Imagine a situation. You ask how we help overcoming it. So then my Ministry of Health authority saying that, look, this is our plan. We want to achieve that in 2 years. And you see that this plan has activities for 10 years, right? What shall you do?
Yeah,
So here the trick comes, right? You cannot criticize, you cannot accept. So you need to be deep and diligent enough to propose a way forward, which is acceptable and meaningful.
got it. So it's a game of prioritization and finding the balance or advocating for what's the highest priority, understanding there's going to be sacrifices.
Exactly. The keyword sacrifices also. Yeah, yeah.
Yeah, no, fair. Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now, back to the show. Can you share some examples? You talked about real world applications
Mm,
actually, you know, getting the technology in the hands of the end users and
mm.
maybe a specific story of a successful digital health implementation that bridged the gap between research and real world application.
All right. So you mean actually successful examples of digital health implementations from bench to bedside, right?
Yes, exactly.
Mm. Well, it's very cool when big corporations presents you iPad and Tesla, but for me, it's much more interesting when a group of, two free students or professionals are creating something innovative and new, right?
Sure.
So if you allow me to give this kind of example, uh, okay. Uh, so in machine learning, we know one field, right, which really delivers. That's
Hmm.
machine learning in radiology, right? When
Okay.
we analyze imaging for diagnostic.
Yes.
So starting from the first application, which, as you know, was ophthalmology, diabetic retinopathy, right, years ago. Afterwards, we have already hundreds of licensed, certified algorithms. And there have been a few guys, young guys in my home country in
Sure.
Lithuania, in Vilnius, who were playing with chest X-ray data.
Okay.
And the result of that was a quite nice product, which could diagnose up to 40 conditions just from simple chest X-ray.
Wow.
40, yeah. After that, these guys made all certifications, so it's medical device, one of the best in the world. But here's the most interesting part of the story. So you would expect that healthcare facilities and doctors will start using it to diagnose something, right?
Sure. Sure.
But the reality was different. Actually, that didn't doctors and facilities wouldn't like to do that because it doesn't integrate in the workflow,
Got it.
because the legislation doesn't allow it, because they anyway need to double check and there is no gain. So they found out that the best way and how it's actually used today in practice for this algorithm is to identify healthy patients,
Got it.
right? And this is exactly the way how it's used today in, for example, outpatient or inpatient settings. So let's say 95% of your patients have completely normal chest X-ray,
Sure.
and that gives us a lot of uh, information, right? So first of all, radiologists can prioritize really sick patients, right? Second, it helps with documentation and so forth. So this solution of Oxipit, it's called the company. I think it's one of these interesting cases when research ended up in a very good product, but completely in different way, not the way we expected.
Got it. Okay. So what I'm taking from that is, as you're applying the research to the real world application, there needs to be a flexibility in the objective and maybe the specific use case that you envision doesn't end up coming to fruition, but that doesn't mean there's not a successful use case. And being willing to be flexible in that application is a means of getting to real world application success.
Absolutely, absolutely. And my personal story when I was defending my PhD and I had this application of machine learning to identify ultrasound cardiology imaging diagnostics. I was so proud of myself till the moment professor said, but do you understand that your research will not be used in medical settings for next 10 years?
Yeah,
And I was really, I was very naive back then, not
sure.
understanding the whole process of, certification, etc. And he was 100% right.
Yeah, there's something about this the pace of healthcare that tends to shock those coming from other industries or just new to the industry. Um, so yeah, as we've talked, it sounds like we've discovered, a third. So we've got regulatory constraints, we've got financial constraints, but in the example you just mentioned, there's workflow constraints. And would love to hear how, when you're working with a research generated project, how you proactively help uncover the potential workflow constraints prior to attempting application or attempting any type of go live.
Well, it's a complicated question. So the first answer, perhaps we already know. First of all, during the research phase, we cannot predict how this application will be really used, right?
Sure.
So this we need to understand that we need to allow certain flexibility.
Yes.
The second thing is that when you're approaching application, you really need to get into user-centric design mode, right?
Mm,
You really need to get into workflow, not to assume things. And I give you latest example. We were thinking about national project of machine learning algorithm for the stroke, for identification of a stroke based on images. So we have this fantastic algorithm, right, which can do the job 99% accuracy level, etc., etc. But after speaking with all doctors who are involved, we realized if the answer is not reaching them within 1 minute, they're not using it. All right. Now, imagine you're doing national system. So there is a lot of movement of data, CT images from a hospital to national system, then to this machine learning cloud and back, etc., etc. Will it fly? No. Is it a fault of the algorithm? Also no. It's a fault of design and architecture. So only when you go through that nuances, right, you
sure.
can apply right workflow, right architecture, and have a meaningful result.
Got it. So user centric design is critical for success.
Absolutely, absolutely.
So we've talked about data a bit, and I actually would love to get a little bit more into data movement. And so when you're working on, or assuming you're working on cross-border digital health projects, or maybe even just digital health products spanning a region within a particular country or market, how do you ensure data interoperability and privacy while you advise on these projects?
Well, Tyler, we are very privileged here in European Union. I would
Okay.
say we have more than a decade of successful cross-border health data exchange experience. And maybe it would be interesting to the listeners of our podcast that in Europe we had this EPSOS pilot project like 10 or 15 years ago.
Okay.
And during this pilot, we tested the interoperability standards. And during this test, 20 countries have successfully tested exchange of patient summaries and e-prescriptions. So back then we tested, we saw that okay, these standards, HL7, etc., and others, they do work,
Got
and
it.
we started implementing under umbrella of EU multinational exchange. So today we're having already European Health Data Space project, which is very active, but the result is quite simple. today living in Austria or in Lithuania, I can go to a neighboring country with different legislation, with different health system, and get my prescribed antibiotic in a pharmacy there, right?
Love it.
Without paper prescription. Okay? And the data about prescription and dispense will follow me when I return back to my home country.
Sure.
So all of that is based on standards. So the idea perhaps is not to reinvent the bicycle. And what I'm telling my customers, we need to know which standards are verified. This is very important because we have overlapping standardization in healthcare, right?
Right.
So what is really working and verified? There is a proof that it works, and we suggest definitely to see how it works in European Union.
So obviously the U.S. is still in this journey of interoperability, but I do know, I started my career during the High Tech Act, which was
Mm.
created by the stimulus, which was 2008. Essentially a recession pushed us into making this change, and would love to hear. We talked about constraints, which I think can also be drivers, regulatory, financial. And how did the EU push forward this adoption of standards? Were there financial incentives? Was it regulatory? Was it carrot and stick? Would love to hear how that was, pushed forward.
Yeah, it's a very interesting question indeed. And you mentioned about recession, and I can mention that in EU now we're looking at United States and see fantastic progress with AI LLMs, and
Sure.
it's one of us stimulus for us, especially for secondary data use, which is second pillar of our HDS project, right? So I think we're looking both ways, learning from each other, but basically, yes, it's stick and carrot. However, the key premises of all this possibility is the promise of EU to all member countries that there is a freedom of movement not only physically, but that means my data also moves with me, right?
Got it.
So if we have this interoperability of healthcare services between countries, we must assure doesn't matter what is the position on interoperability or which system to use of particular country, but we must agree how to exchange data, right? So
Right.
we agree to agree. And then regretfully, it took 10 years for us really to implement that.
Sure.
But, but today, finally, we have not only a bunch of legislation, but we have real active implementation with a very clear pathway for next 5 years, what type of data and when should be available. Carrot and stick, you said. Exact.
Yes.
Carrot, we provide certain financing, right? So
Okay.
imagine federal financing for the states. And at the same time, it's a stick. If you don't deliver, right, then something bad gonna happen. Either you need to return money, or you got a fine.
So essentially rooted in honest, almost like like healthcare is a right type mindset. It's essentially like,
Yeah.
as we agree that the EU is a connected union of countries, that also implies or forces us to exchange health data in order to live up to essentially the mission of the EU when it pertains to healthcare.
Yes. Yes. Absolutely.
Very cool. Very cool. Well, so we've talked about how, yeah, when you were defending your doctorate, you got the advice that in 10 years you'll probably see the realization of your vision. And so if we're looking 10 years ahead, flash forward to 2035, what technologies or innovations that exist today in terms of they are viable and could be implemented, but may take that decades long time frame, do you believe we'll see being exist right now, but we won't see their usage manifesting until 2035?
Hmm. Well, just not to be banal in speaking about AI, right? I
Sure.
will try to take it. a bit wider approach. So I think that most of technologies today underutilized. So
Hmm.
let's try me prove my statement.
Sure.
If you take digitalization level of hospitals, right? Not speaking about national levels or countries,
Sure.
you will hardly find many facilities which, speaking in HIMSS terms, are above level 3 or 4. So, what does
Got
it
it.
mean? We have technology for 20, 30 years, but most of hospitals still not adopting them, right?
Right.
So, and we're speaking about very simplistic technologies, not some, AI, ML technologies which we need to discuss if we can trust them.
Right.
So, in that sense, for me, it's very regretful that virtual assistants and telemedicine is still not used. And I question myself and my colleagues, experts, when we're gonna have, wide uh, dissemination of this technology, right? So
Yes.
virtual guidance, virtual assistance. So that's quite interesting. And I can give a speculative answer that I think within 10 years we're going to have it. But I cannot tell you if it's 5 or 8 years or 2 years, right?
Sure.
Yeah, and finally, only a handful of countries are enjoying possibilities of regional or national e-booking systems, right? Or e-referral systems. Can you imagine that in my country, I can go to a portal and choose a cardiologist, and it will be a list of almost all cardiologists in the country, the facility in specific region, and see his or her calendar of availability for outpatient consultation. So technology is there, but not many countries legally or because different health systems can afford that, right?
Right.
So it's still a long way to go.
Sure. Sure. Well, I guess in a way that's somewhat of job security, although in a lot of ways we would, as users of this, since the amazing part about being in this industry is we're all users at a certain point, hopefully for just maintaining great health, but also when catastrophe strikes. So yeah, we would all love to see these timelines move up faster.
Yeah.
On another looking ahead question, and the great part about this is I presume you think about this more than some others that we have on this podcast because you're in an academic setting during some part of your week or
Yeah.
your day. So what advice would you give healthcare leaders who are just beginning their digital transformation journey?
Oh, what a great question. What a great question indeed. Well, first of all, I not only advise, I would beg them not to underestimate complexity of the endeavor they're starting with digital transformation. And they have to accept the fact that regardless if their background is medical, business administration, or other,
Hmm.
they and their team will need to take part and understand what they are doing exactly. I have a beautiful example. I
We
had
love
a
beautiful examples. So.
Oh, fantastic. That was my one of the first, or maybe the first digital transformation project in huge research hospital in Europe. And I've requested presence of the CEO of that hospital to a steering committee where we had to decide on priorities and scope of digitalization.
Sure.
And the CEO was furious. He was complaining. But he said, Olegas, if every project in my hospital will require my presence, I will not have time to work, he said to me.
Hmm.
And it's needless to say that after certain time, when the system went live, he was furious again, asking who made that decisions on the scope and priorities. And this is very illustrative. Many healthcare leaders who are out of this field, they understand digital transformation as a job of IT guys, IT department.
Right.
And this is very, very wrong. So my advice is be engaged and please understand three things about each digital intervention. That three things are what, why, and how things will be done. Very simple.
Yeah, no, love that. What, why, and how, and the cultural impacts of IT digital transformation cannot be understated. I can see the image of that CEO as you tell that story.
Absolutely.
Well, oh, yes. This has been an awesome conversation. Obviously, great to get to know you more through this dialogue. And, we always love talking with leaders like yourself, especially those that can expand our understanding of the space. And so your perspective, coming from a different industry, spanning the globe across digital health transformation from Kenya to Indonesia to Europe has just been fantastic. So wanted to thank you so much for spending some time with us today, and have a great rest of your day or night wherever you are in the globe right now.
Thank you. Thank you so much for having me in Quick Hits and wishing you a lot of success.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.